Jackson Health System is the only public health system in Miami-Dade County. It is one of the largest health systems in the country. We have 6 hospitals and multiple specialty and primary care clinics throughout the county. Jackson Health System has a $1 billion capital improvement program over 5 years. It was hard to manage a budget without an existing system because we didn't have full transparency into what was in process but not yet fully executed. We were constantly looking at historical data from the financial system. So anything in process you couldn't capture, and you didn't have an easy way to forecast.
Prior to eBuilder, we managed projects through our internal accounting system, which had numerous reports that were being done for a simple answer as to where what had been spent for construction, what had been committed, what had been paid. You didn't really have a clear picture of exact things that were being charged.
I would have to run multiple reports on our accounting software here at the hospital, then compile everything onto another spreadsheet and do a lot of math to kind of guesstimate, and which left us open to a lot of risk with formula errors and whatnot.
We have 72 active projects in eBuilder, and ranging from every phase of development, from planning, design to construction. Other departments are doing what we need them to do within the system. I think that what we'll see is that they will start running reports and looking at dashboards within eBuilder as well.
Since implementing eBuilder, we've been able to look at real-time information with regard to the processes themselves and correct and make any adjustments that we need to make quickly. We've also been able to provide a level of reporting that previously they were not able to accomplish. We've seen a huge improvement in the invoicing turnaround. We've been able to really use that to better the relationships with the community, with the SBE communities, with vendor community. We've also seen an improvement in our procurement processes, where we've been able to communicate with that department and really improve overall how the program is delivered.
I use eBuilder primarily for budget management. I'm able to see everything on one screen. I've got my budget, my current committed amounts, paid to date, and then I'm also able to forecast, which really helps me keep an eye on my big picture overall project cost.
The biggest lesson I think we learned with the process, especially at the beginnings, we began with one-way communication from our financial software into eBuilder. Ultimately, that didn't give us what we needed in order to manage the project properly. So we did end up going back and then establishing two-way communications.
I think the biggest thing the external users get from eBuilder right now is the transparency. They see exactly where things are at. It's the follow-through. RFIs, submittals, invoices, any kind of documentation is clearly found there. You clearly can see who's following up on it. The eBuilder mobile app has helped me a lot because sometimes I'm out in the field, sometimes I'm running between the main office, a meeting here, a meeting there, and there's nothing that gets delayed. I can look at the mobile app anytime. It's convenient for me, and I think it's convenient for external users too.
Well, I would say the biggest impact is the ability to truly manage our budgets and having the right tools to try and maintain. We are managing this program with fixed budgets for the project, so it is key that we be able to manage that and forecast what the needs are and actually bring in the project within budget.